Hey everybody, Dr. Tom over the Active Healing Center. For our class today, we are focusing on sciatica. For our last session last month, we talked about low back pain. And a real quick synopsis on why do you have low back pain, we said, to keep it simple, you've lost either the normal structure, the normal function, either basically usually a combination of the two. You've lost some symmetry and balance in the lower spine. And there's where you open the door for pain, inflammation, these types of things that rear their head. Now with sciatica, what it's ultimately telling us is a nerve is being irritated. Sciatica is just relative to your sciatic nerve. It's the most common nerve in your lower spine that's irritated and involved because it's at the very base of the spine. So the sciatic nerve is made up of these last couple of segments, the nerves that come out from the last couple of segments of your low back into the sacrum. They all form what's called your sciatic nerve, which travels down through your butt underneath the piriformis muscle, which is a muscle we highlighted in one of our mobility videos, but it comes underneath your piriformis muscle, down the back of your thigh, into your leg, all the way down to your feet and toes. But again, it's telling us a nerve is being irritated, just like any other nerve can be irritated in the low back. And that's the goal. That's the issue that we want to get to. Is why is this nerve being irritated? What's going on in there? And there's where we start to do our proper evaluation. I put a lot of emphasis on our x-rays because the x-rays is where we're looking at normal structure. So I'm looking at it straight on. Are you normal? And again, there's always a difference, and we have to know the difference between normal versus abnormal. And there absolutely is a difference in normal structure versus abnormal structure. Do we have normal function versus abnormal function? And when we know the differences there, well, that's how we can best put a plan together to solve those problems. There are solutions to these problems. We just need to identify the area and then put the plan into effect. And when we do the things, the right things over and over again, there's where we start to get results with these types of problems. Because these problems now become devastating to how you live your life. They can be devastating to the overall quality of your life, because the nerves, once the nerve is irritated, the nerves are what control the function of your body. And once the nerve is involved, well, you're losing function of your body. And it's dramatic and it's significant and it needs to be dealt with. So just real quick on why we have those nerve problems. When we've lost proper structure and function of the lower spine, well, now we lead to degeneration, aka arthritis. And the longer that degeneration is allowed to be there, the bigger the problems that we start to have. So do you have normal, or do we start to feed into phase 1 degeneration? And there are grades of degeneration. The more degeneration, the more apt that you're just going to be sitting there talking to a surgeon. And that's where we don't want you to get to. So when we have that degeneration going on in there, ultimately what starts to happen is twofold. Either you start to get damage to your discs, or you start to get bone spurs. And we'll talk about the bone spurs for a quick second before we get into a disc. So the reason why we want all these good structures and good functions of the spine, just like you have arches in your feet, we need all these structures there, all these curvatures. We need them to be as normal as we possibly can, because that's what helps us deal with stress being placed on our body. So we have all this stress. Just take gravity alone. All the stress being placed on us. When everything's doing its job throughout your spine, well, all that stress gets dispersed equally throughout the spine. But once we start to break it down for whatever reason, well, now we start to get focal points of stress. And that focal point of stress is extremely damaging. The longer that's allowed to be there, well, now we start to build up what we call bone spurs, because we have more bone growth going on. More pressure on a bone, the more bone growth, that creates a bone spur. And typically when those bone spurs form, they usually will form in one of 3 spots, maybe all 3 spots, but it's usually going to form in the left part of the joint, the right part of the joint, or the back of the joint. And either way, when we get into the disc, it's the same thing, but either way, there's a nerve there. You have nerves that come off the left part of the spine, you have nerves that come off the right side of your spine, and then you have your spinal cord which sits in the back part of your spine. So wherever these bone spurs form, most likely there's a nerve sitting right there. And once we start putting pressure on that, well, that's where we start to create functional loss in your body. And that can be, again, devastating. So the bone spurs are a form of degeneration because we start getting focal points of stress at a specific area, bone spur forms. Now a disc, The way I like to explain a disc, real simple, a disc is the cartilage in your spine, okay? But it's a little bit different than like the cartilage in your knee. So a disc in your spine, it's like a jelly donut. So you have the tough fibrous outer layer of the disc, and then the center of the disc is literally a jelly. So that when we get damage and degeneration of the spine, we're breaking down. Typically, it's not symmetrical unless there's a trauma, a direct blow to the spine. Typically, that damage is being done asymmetrically. So we're getting more pressure on one side of the spine than the other part of the spine. And when we're looking at the disc, well, when we start to put pressure on one side of the disc, it's like squeezing the jelly donut. Now that jelly has to get pushed in one direction. And typically, it's getting pushed left, pushed right, or backwards. And again, same thing as with the spurs. If it's going left, there's a spinal nerve on the left. If it goes right, there's a spinal nerve on the right. If it goes backwards, there's your spinal cord. So in any direction it goes, problem is going to be nerve irritation, and that is, again, devastating and damaging. And we want to get on top of these problems because the longer they're allowed to be there, the more problems we're going to create. So it's not about age ever. It's about length of time the problem is allowed to be there. The problem's never there. It does not matter. You should never have these problems. You know, your age is not the factor there. So the normal function, or the loss of it, the normal function, the normal structure, that's the issue we want to get at. And then quick signs. Well, how do you know that you're starting to develop these types of problems? Well, typically what you start to look at are, well, do you have some loss of function, all right? And how can you figure that out in your lower spine? Well, maybe it's harder for you to bend down and tie your shoes. Maybe it's harder for you to go and put your socks on, just a little stiff. Maybe you don't have pain, but maybe it's just stiff, achy, or it's just almost, you just can't get to that point to put your shoes on. Maybe you need help to put your shoes on because you can't bend that way. Maybe when you're turning, you feel some stiffness or achiness. Maybe when you're bending over, maybe you're washing dishes in the sink, or you're doing some gardening, and you go to get up, and those muscles just don't want to fire, and they just feel like they just lock into a certain position. There's your body telling you, we got a problem here. There's an issue going on, and we need some sort of resolution here. Maybe it's an easy solution, or maybe we need more drastic, a more drastic type of solution for it. But it's telling us that there is a problem. Maybe you start to get some things like tingling or numbness in your toes, or maybe a part of your leg starts to feel a little weird. When you touch it, it feels a little more sensitive. Well, there's a sign that a nerve is being irritated, all right? And that's where we want to jump on the problem. Don't let it go, because it's not the severity of the problem. It's once it's there, it's telling us that the nerve is being involved. The longer we let it stay there, well, now it's opening the door for big, huge problems, devastating types of problems where you lose function of a leg. Maybe you lose function of things like your bladder or your lower digestive tract, and you lose control of your bowels. Those are emergency situations, and it's all because we're getting problems and damage being done to the lower part of your spine. And again, this is where we want to stay away from. We don't want you on the surgery table. We want you to be able to put an easy plan together. Maybe it's just some stretching that needs to be done to loosen up the muscles. And again, a quick thing about that, and people always like to ask, well, is it a muscle problem or is it a joint problem? And typically, it's a combination. Muscles move joints. That's their job. So if I damage a muscle, if I don't do the right things to get the muscle back on track, well, it's not going to allow the joint to ever function correctly. So if I never fix the muscle problem, it's going to become a joint problem. I mean, if I have a joint problem, well, it's going to involve and affect the way the muscles are functioning. So either way, it's typically a combination of a muscle and joint problem. So goal is get it identified. If you notice these problems, you're losing some of your mobility, you're starting to have some pain or problems into your legs, then you need to get help. And just real quick, when we're looking at the lower spine, when we look at the upper part of the lower spine, these are the nerves that typically feed into like the hip and groin area. So again, it could be pain, tingling, numbness, weakness, sensitivity to cold or heat, things of that nature, weakness, all right, loss of muscle tone. All of these come in play when the nerve is getting irritated. And every nerve below that just feeds a little farther down the leg, so that when we get to that very base of this low back part of the spine, that's what's feeding into the feet and toes. And again, it runs the gamut in terms of symptoms. So just pay attention to how your body is functioning. And then think about your life a little bit. Have you been in a car accident? Did you fall off your bike when you were a kid? Did you fall out of a tree? Things of that nature. Again, it has nothing to do about when it happened. It just matters what you did to get things back on track. If you did nothing, well, chances are you have lost some structure and functional balance in your body. Now the door has been left open for other issues, disc problems. That's why so many people do have disc problems. They may not know it until it starts to become very significant, very severe in terms of its symptoms. And that's generally when people start to come in here. They're hard to move. They can't move. They can barely get up out of a chair. They can't get into a car because that pain has been, the level of pain and discomfort is so bad. Well, that's a problem again. Pay attention to how your body's functioning. If you notice you've lost some function, if you start to feel some issues in your extremities, get it evaluated, because the sooner you can jump on it, the easier. It's so much easier to get things back on track. The longer it's allowed to be there, and the more severe these symptoms become. Well, obviously, the bigger the problem. So if you have issues, give us a call. That's what we're here to help. Put some plans into effect. If you're doing some simple things at home and it's been a month, 2 months, and the problem's not really getting better, well, you need some sort of intervention. You need to get in there and identify what the problem, where the problem is, and then put the right plan into effect. Hope you got something out of it. Take care.